public health PhD program. I'm Sidra Goldman-Mellor. I'm the director of the PhD program in public health at UC Merced. I'm also a professor of public health here. With me on the webinar is Jess Ventura. So she's a central staff member in the graduate division at UC Merced. She helps out with grad student recruitment and admissions and various other things. And so she is on hand to help me answer questions that I don't know the answer to, and that she does, because there are some things that I can talk sort of specifically about the public health PhD program, but Jess knows more about kind of standard, like, application process, basically, stuff that I don't know anything about. So there's only a few of you on the call. I was hoping that you guys could just put in the chat really quick where you are right now. Like, are you a UC Merced student? Are you a student in another program? Are you working? That would just like help me to know, yeah, like where everybody's coming from, basically. So Naz, a UC Merced student, I know that, welcome. I will put my name in there too. Oh, in Arizona State. I am from Arizona originally. Welcome, Haley. Okay, great. UC Davis, currently working. Terrific. Haley, I grew up in Tucson. My parents were professors at U of A, but so I spent much of my life feeling like a strong rivalry with ASU, but I have let that go. Let's see. Okay. So I have some slides to show you guys, just to kind of like go over some basics, like what our PhD program is all about. But feel free to interrupt me, like put stuff in the chat. Oh, Claire, okay, great, thank you. Terrific. And Curly in Vietnam, oh my goodness, what time is it there? Thank you for calling in, kudos to you. So I was going to show some slides, but again, like, don't hesitate to interrupt me. I'm happy to answer questions. I'll monitor the chat, and then I will make sure to leave time at the end for like more Q&A session if anything comes up. Let's see. Okay, let me share my screen. All right. Okay, there we go. Let's see, a little bit more about me. So so like I said, I'm a professor in the public health program. I have been at UC Merced since 2014, so I've been here for a little over 8 years. I myself am an epidemiologist, so I did my graduate training. So I have both an MPH and a PhD from UC Berkeley. So I did my graduate training in the UC system also. My PhD is in epidemiology. And I personally study mental health problems, particularly suicidal behavior, but I have done research on various mental health problems. I also teach both graduate classes in our PhD program, and I teach at our undergraduate level. So we have an undergraduate public health major and a public health minor at UC Merced. So I teach and I do research, and I mentor PhD students, and I do things like run the PhD program. So I wear many hats. Let's see. Okay, but more about the PhD in public health, our actual program. So first off, it sounds like only one of you, is currently at UC Merced or has some sort of affiliation with UC Merced. So for those of you who don't have any experience with UC Merced, I thought it would be helpful just to tell you a little bit about kind of the campus and graduate studies at UC Merced. So if you're not too familiar with it, UC Merced is the 10th campus and the newest campus of the University of California system. So I'll go into a little bit where we're located, but we are both an undergraduate and a graduate institution, right? So we've got undergrad majors and then PhD programs and a couple of master's programs also. And the graduate community is one of the major pillars of UC Merced as an institution. And it is built on these kind of founding principles of diversity and interdisciplinarity. UC Merced is the smallest of the UC campuses, so it kind of feels more intimate. And from the very get-go, like pretty much of the graduate programs were like pretty interdisciplinary. And so students would like take classes in other, departments or other programs. And that's really been sort of like an ongoing strength of the university. So our academic programs tend to be innovative. Because they're small, our programs tend to have close working relationships between the students and the faculty. But that said, even though, it's sort of a smaller environment than many of the UCs, there's a huge kind of diversity and range of things that graduate students study at UC Merced. So I'm in public health, but there are programs in sustainable energy. Students are studying antibiotic resistance, genomics, language acquisition, social movements, robotics, all kinds of different things. So there's a big range. Okay, so UC Merced is organized into 3 different schools. We have the School of Engineering, the School of Natural Sciences, and the School of Social Sciences, Humanities, and Arts. And that's where the public health department and program are located in. So listed here are all of the different PhD programs within those different schools. Let's see. So it's sort of useful to show that because public health PhD students often take classes in these other programs, right? So our students frequently take classes in psychology, in sociology, sometimes in the cognitive and information sciences department, sometimes in the quantitative and systems biology program, sometimes in environmental systems programs. So they've taken electives in a variety of different programs. So if you're not too familiar with UC Merced, so here's California. And Merced, the city of Merced is located smack dab in the middle of the state. So right where this little pointer is. Yosemite National Park is right up here. So it's about an hour and a half drive away. There's a bus that you can get if you don't want to drive yourself. It's very convenient. We're also about 2 hours from Sacramento, 2 hours from the San Francisco Bay Area, up here, about 2 hours from Silicon Valley, and we're about 4 to 5 hours, depending on traffic, from Los Angeles. And we're also about 2 hours or maybe a little less than that from the coast, like if you want to get to Santa Cruz or anything. So we're kind of really right in the middle. The University of California, so UC Merced draws from students both all over California, but also so a lot of, at least in public health, a lot of our students, or some of them anyway, are from the Central Valley of California, but many of them are from other parts of California, other parts of the United States, and we do have several international students as well from a wide variety of different countries. So the campus as a whole is very diverse, very committed to sustainability and environmental stewardship. All of our buildings are brand new, which is because it's such a young campus. They're all LEED certified. So environmental kinds of issues are a big focus of the campus. In terms of sort of quality of life, what it's like to live here, because so Merced is it's in the San Joaquin Valley, which is kind of the agricultural heartland of California. So it is a more rural area than LA or San Francisco. And that comes with reasonable housing costs and lower cost of living, which is nice for graduate students. There's still a fair amount to do in the area, and we're near a lake. There's like bike paths, there's like a bunch of different stuff to do, and like within the sort of immediate region. And then we're also, it's easy to do day trips to other places like San Francisco, like to Yosemite, etc. Let's see, if just a quick comparison to our other kind of sister campuses at the other UC schools. We do have the best affordability. So this is like the living wage, right? It's like, what do you have to earn per hour in order to kind of be able to afford a reasonable life here? So we have the lowest living wage and the lowest cost of housing, because it is much cheaper to live here than it is in basically any of the other locations of our sister campuses. Okay, so that's just like a little bit of background about UC Merced in general. Graduate students always want to know, like, what is it like to live here? Most people have, not really been to Merced, so I like to provide some background to that. So getting more specifically into the public health PhD program. So our mission is to promote and protect health in the San Joaquin Valley, which is where we're located, but also in California and the broader world, through research and action. And part of that is by preparing and training the next generation of public health leaders, right? Professionals, researchers, et cetera. So we're a kind of a tight-knit community. It's very collegial, it's vibrant, and our faculty and our students are engaged in cutting-edge research, and a lot of us are doing interdisciplinary work. The doctoral program itself is full-time, and it is in person. That is something that I get asked about a lot in our post-COVID era. It is an in-person program. I can talk more about that if anyone's interested. And because it's a PhD program, it really is designed to prepare students for research careers, right? You come out of a PhD knowing how to do research. But what we don't assume is that our students want necessarily to go into academia. So we prepare them for research careers, but many of our students come in knowing that they like research, they want to pursue research, but that doesn't necessarily mean that they want to become a professor, basically, or like so our students come in with a variety of different career goals. So some of them go on to faculty positions, but some of them go on to private industry, to working in county or state public health departments, et cetera, kind of the full gamut of public health careers. So our faculty, there are 13 of us. So we have a variety of different areas of expertise. Those include air pollution and other kinds of environmental pollution, asthma, kind of respiratory health in general. Like I said, I do mental and behavioral health. We have a few faculty who work on cancer prevention and nutrition. Some of us do research on chronic disease prevention, health disparities, health policy, maternal, child, and perinatal health. That's also an area that I focus on. Latino and immigrant health, vector ecology, and spatial statistics. So this is us. I'm not going to go through everybody in detail because that's probably not a great use of anybody's time. I'm happy to answer questions about anyone if you have specific questions about anybody. I'll just point out that Professor Asa Bradman is the chair of the department. And then there's me, so I am the graduate chair, or basically like the director of the graduate, or the PhD. The program curriculum, so it focuses students on acquiring conceptual and methodological skills that you've got to have in order to operate as an independent researcher, right? That's what we want you to be at the end of the PhD, and so we make sure you get the skills you need to do that. On average, students take about 2.5 years of coursework. And that coursework includes both core courses in epidemiology, statistics, social and behavioral health, environmental health, and health services research. And then you choose from a range of electives, and you can choose electives both within public health as well as from courses that are taught in other disciplines in other departments across campus. The methods training, this is because we are a PhD in public health, right? So that's inherently sort of an interdisciplinary approach. We're not a PhD program in like epidemiology or health policy. It's a PhD in public health. And what that means is that the methods training for our students includes both quantitative and qualitative, as well as kind of mixed methods approaches. We also kind of emphasize community engaged research, although certainly not all of our students actually do community engaged research, but everybody gets training in both quantitative and qualitative methods. So most students, like while they're doing coursework, they're also starting to do research. And in total, students are involved in research, certainly at least starting in their second year and often in their first year. So you're kind of doing both coursework and research at the same time, although the balance of those things sort of shifts over time, right? So at first it's like more coursework and less research, and then that kind of like changes and ends up being like entirely research by the time you're done. We work under a mentorship model, so all students work closely with a supervising faculty advisor. So that's like a single person, but all students also have an advisory committee of 2 or 3 other people who provide feedback and sort of support around research, around what classes they're taking, and then for their dissertation. So the normative time to degree is about 5 years. I'll be honest, our current students, because of everything related to COVID, many of our students got slowed down, as everybody did during COVID. And so our current students are probably taking a little bit longer than 5 years on average, but it's just COVID related, basically. Let me pause here. Any questions on anything so far? I haven't seen anything come up in the chat. But if anybody has any questions, please stop me. Okay, I'll keep going. So our graduate students are diverse. So right now we've got about 24 students currently enrolled. Like I said, some of them are from California, some of them from other places in the US, some of them are international students. They're a very collegial group. They've formed pretty tight bonds with each other. It's a supportive place to be a PhD student. And they are bringing their life experiences and perspectives and previous training to ask, to investigate a huge range of different kinds of research questions. Let's see, I think most of them, if you ask them, I think would tell you that they like living in Merced. It is a small but growing city, actually like pretty rapidly growing. It's got about 80,000 people in it right now. The rent for a 1-bedroom apartment is, if you were to live there by yourself, it'd be about $1,200 a month. Many people end up, sharing, or living in a house with roommates. Like I said, it's about a 2-hour drive from a bunch of places. There is a small airport in Merced that has daily flights to the big Los Angeles airport and actually to Las Vegas, I think. And there's also train stations, so you can get trains to Oakland, Sacramento, and then like farther down the San Joaquin Valley if you want to visit friends or family or something. And then there's a larger airport in Fresno, which is a big city that's about an hour south of us. Okay, so for the PhD program, depends a little bit on the year. We typically enroll about 4 to 10 students per cohort. This cohort, I mean, it really just depends on the applicant pool, but we're trying to admit on the higher end of that. But again, it just like depends on the applicant pool. All admitted doctoral students receive full financial support each semester. That comes with a range of kind of different things. Teaching assistantships, right? So like being a TA for our undergraduate major or undergraduate classes. Some students get graduate student research positions, and some get fellowships. Our students have had pretty good luck getting both internal fellowships that are given out by UC Merced, as well as competing for external fellowships. Students also generally receive summer support that they can use for a range of things. So living costs during the summer is what many students use at least part of it for, but it can also be used for research purposes, training, like if you want to go do a workshop somewhere, if you need to buy yourself a new laptop, that kind of thing. We also provide additional support for some graduate student travel to conferences and those kinds of professional meetings. Let's see, okay. So if you are putting together your application, I do have some recommendations. So please make sure to review our faculty and check out their websites, particularly looking at their research interests. We want to make sure that the students that we admit have a good potential match in terms of a faculty advisor. Yes, like we are reviewing the applications, but it's just as much about like you guys evaluating whether our program is a good fit for you as it is us evaluating whether like you're a good fit for us. So it's very much like a matchmaking kind of thing. And the best way to really figure that out is to, look at our faculty, talk to our faculty, make sure that, that they're doing stuff that align with what you want to do. So related to that, when you're checking out our faculty, we strongly encourage prospective students to reach out to existing faculty members to talk with them and get a sense of whether their research lab is accepting new students, whether they're doing work that you're interested in, whether your training and background would be a good fit for that, whether your career goals are like, a good fit for the kind of training that we provide, all those things. We don't have like a formal interview process or anything. This is really, it's like an informal thing that is helpful on both sides, basically, to figure out whether it's a good match. What we're looking for are students who demonstrate commitment to conducting research on a focused topic in public health. We are looking for students who, have a reasonably strong idea of what they want to do their research on. No, we don't expect people to come in knowing like exactly what their dissertation is going to be about, but we want to know, that you are really interested in mental and behavioral health and have maybe done a little bit on that, are interested in like substance abuse in particular and, something related to that. We want to know that you have a focused area of interest. We're also looking for students who have strong writing ability, an interdisciplinary mindset, right? Because this is an interdisciplinary program, motivation to work independently, because that is basically, required. Like, yes, you'll have a faculty advisor, but all PhD students, have to learn to work independently. So we want to see that they've got that motivation. We want to see that you have an interest in pursuing some kind of a research career and that you have alignment with our faculty research areas. So like, if you know that you're really specifically interested in like liver cancer research, our program is not going to be a good fit because we don't have anyone who does liver cancer research. We do accept and welcome applications from students with a wide range of undergraduate degrees. We don't assume that you have, a strong background in public health at all. You just have to be able to articulate, if like you majored in psychology and did research in psychology or in biology, like be able to tell us why that sort of prepares you and why you're interested in doing research and getting training in public health. We don't require an MPH or some other kind of master's degree. It's encouraged, but it is not required. We do require the GRE this year. Starting next year, we will not require it, but we do require it for this year. We also recommend that you have some kind of prior experience with quantitative or statistical coursework, but for right now, we're not requiring that. Starting next year, those things are going to switch. So we're going to do away with get rid of the GRE requirement, but we will start requiring that applicants have taken a statistics course, maybe in undergrad, maybe in their master's degree. If they don't have either of those, then we will require that they take a statistics class like at at their local community college or something, because we want to ensure that applicants are coming in with like sort of a baseline of statistical training. But that's next year. For this year, we require the GRE. Let's see. Okay. In your application materials, we recommend that you mention specific faculty, maybe that you've spoken to, or at least that you know whose research interests align with yours. We also recommend that you demonstrate your commitment to research. So any involvement that you've had in research in your undergrad, program, in your MPH program, and whatever, any sort of post-college career work that you've done, talk about your involvement in research. We want to see that you actually do have commitment to research and that you kind of know what you're getting into, at least to a certain extent, when applying to a PhD program. We also recommend that you outline your specific research interests, maybe the methods that you're interested in pursuing, the approaches that you're interested in learning, and talk about your future career goals. So all of this is also kind of laid out on our website. In addition, if you go to this link on our website, we have laid out or provided some resources on how to approach and talk with faculty, because we know that can be a little bit scary sometimes, and just kind of a more guidance on what to do in this period, like where you're figuring out whether you want to apply and what your materials should look like. So do go check out that website. Let's see, our deadline is January 15th for the applications. So what's required for the application is the application form and the fee. If you're interested in an application fee waiver, please let me know. You can, what I would recommend is emailing me and Jess Ventura, who's on the line. So we'll provide our email addresses. Please email us after the webinar, and Jess will give you, she can give you the information about the fee waivers and how to do this. So we also require your official transcripts and your GRE score report, your statement of your research interests and career goals, 3 letters of recommendation, and try to have at least one of those be from a professor. If your native language is not English, we require the TOEFL. And again, a master's degree is encouraged, but it is not required. And I think that is it in terms of the PowerPoint. So my email is here. Jess can provide her email in the chat. But then here are a couple of additional links. So if you want to just find out more about kind of graduate studies or the graduate application process, contact grad@ucmerced.edu. If you want to find out more about our public health PhD program, I'm the one to get in touch with. And then here's our website for our PhD program. And then this is the website for the UC Merced like graduate division, which oversees kind of all PhD programs. So I will stop sharing. Oh, thank you. Okay, so Jess put her email in the chat. I'll put mine in there too. Type. Oh, and then I didn't actually include my full email address. Sorry about that. There we go. All right. Can I answer any questions?
I have a question. So, as a grad student, will they be given stipends, or will we be given stipends, just, being in grad school and working research and, in the classrooms as well? Because we will be helping out with the researchers.
Right. So yes, so that's how TA positions and graduate student researcher positions work. So when I said that all students get funding, what that means, what I mean by funding is that if you get a job as a TA or you get a job as a graduate research assistant, that job pays both your tuition and fees, right? To go to the PhD program, but it also pays a stipend. So like it's actually like a fair amount of money, but you only take home part of it, right? Like, but that part is your stipend and the rest of it goes to paying your tuition and fees. But yes, all TA and fellowships and GSR positions, those graduate student researcher positions, all of those come with a stipend. And you get it as a monthly stipend.
Thank you so much, Professor Goldman.
Mm-hmm. Tijan, I saw your hand up. Did you have a...
Yeah, thank you very much for the in-depth presentation.
Sure.
You really make us feel like, yes, we want to come there. But I have a concern pertaining to the GRE.
Yeah.
Yeah, currently where I'm staying in the Gambia, we don't have any GRE center here. But I got double masters in public health, MPH, in health services planning and management. And my first degree was in pharmacy. My other degree was in MPhil in pharmaceutical chemistry. So I currently work with our medicines control agency. It's just like the FDA there.
Oh, okay.
But I'm also currently engaged. Maybe you heard about the injury.
Oh, I'm sorry, you're cutting out a lot.
Yeah, so I'm part of the focal people doing the investigation because of my public health background and also pharmacy background.
Okay.
But now my challenge is the GRE here because there's no GRE center here.
Right.
So I don't know if I could still, but I have this English proficiency because I did all my studies in Ghana.
Okay. Okay.
So I don't know.
I actually don't know
if I could still go ahead and apply.
Yeah.
Because I see you strictly say the GRE is a requirement. So I don't know whether it's possible with my English proficiency.
Right.
Whether that one can at least.
So Jet, let me refer that to Jess because she's gonna have more information about that than I am.
Sorry, I caught the last part of the
Okay.
question. My apologies. I'm guessing, are you asking about a waiver for the English language requirement?
I think he's asking about a waiver for the GRE because he's in the Gambia and it doesn't have any GRE like testing centers there.
So we probably could waive that. We would need to actually work with Dr. Goldman-Mellor about like if that could be okay with them, with their program, since they would actually be reviewing the applications and then possibly decide, is there something that we would require of you in place of the GRE to give us another data point to help make that admissions decision. but that sounds like something that we would need to do on a case, like a one case basis.
Yeah. Yeah, but I think, yeah, we can work with you to figure out a solution for that. But Tijan, I'm sorry, I don't, if I'm mispronouncing your name, I apologize.
No,
if
it's
you
perfect.
could
You
email,
pronounce it well.
okay, great. If you could email me and Jess afterwards, we can go from there and figure it out.
Yeah, we'll work with you,
Perfect.
our admissions department. And so we know that
Okay,
there's different things that
okay,
happen, especially for international students.
Yeah,
all right. Thank you very much. I'll do that.
sure, great. Okay, thanks. Claire, Ala, any other questions?
Hi, I'm Claire, and I do have a questions. So I emailed some of the potential advisors that I think that their research aligns with my interests. And I think it was Dr. Ann who's talked to me, and she mentioned about how for this year UC Merced would actually accept like a student as a cohort instead of like putting them right into with specific professor. So may I ask, like, is that going to impact any of our possibilities to get like funding, or like how do we get the graduate research assistant, or is it going to be appointed to us when we get like, you know, let's say whether it's acceptance letters and all of that?
Yeah, no, that's a great question. So like, yes, we are admitting students as a cohort, but this is sort of like an evolving thing. So it's not a huge department, right? We only have like 13 faculty basically. And so we do admit students as a cohort, but every student is still like assigned to a faculty member, like it's from day one, basically. So and like we try to make those assignments based on who we think the student is likely to end up with in terms of their advisor, right? So like we're trying to match people based on interests. But we recognize that, you know, like you're walking into this like not knowing the faculty member most of the time, right? And like the faculty member is, you know, doesn't know you, and you know, like sometimes it's not a good match either because of like the research interests are not a great match, or, you know, people have different working styles, like all kinds of things, right? So we do our best to make these assignments based on what we think the likely sort of faculty, you know, mentor, advisor, student relationship is going to be, recognizing that students are also completely free to change advisors when they want to. Yeah. So in answer to the second part of your question, so sometimes students, like new students coming into the program, are like, they sort of really do work out an agreement with a faculty member that, like, you know, they're going to be sort of brought in as that person's student, and usually because they're bringing a specific skill set that professor needs, right? And like that professor may have a grant, and they need a student to do XYZ, right? Like on the grant, and you know, the applicant has XYZ skills, and so like that's a match. And so that student is sort of brought on with the understanding that that professor is going to employ them as a GSR, right? Like from the get-go. But that, like, it definitely happens, but it's not, I would say, sort of like the typical thing. So most students in their first year are supported on TA positions. And so, and you don't, like, the student doesn't need to do anything to apply for those. Like, we figure out, like, okay, like, you know, which student is going to be assigned to TA, you know, which undergraduate class in their first semester, basically. And we typically know, like, we have a sense of kind of what what strengths or skills or background the student is bringing to the table. And so like if the student has a background in, let's say, environmental health, you know, we would try to match them up where they're TAing the environmental health class, right? But, you know, like most of our students, well, it's required to TA at least like a few times during the PhD. And many of our students are supported on TA positions like every single semester. And so they sort of like get experience TAing like all of our different classes. But there's nothing you need to do to apply for those. The funding really is like on the faculty side, right? It's like, okay, this student is going to be matched to Professor X because Professor X is going to provide like a GSR position to them, and everybody else is going to get a TA.
Gotcha. I think that answered my questions. Thank you so much.
Okay, yeah, sure. Yeah, and again, like if you want to schedule a follow-up, you know, one-on-one conversation with me, I'm happy to do that.
Gotcha. Thank you.
Yeah. Any other questions? No. All right, well, I'm happy to let everybody reclaim their last 15 minutes of the hour. Thank you so much for attending, and we would love to get all of your applications. And again, so please follow up with me and with Jess, either if you want an application fee waiver, or if you have more questions, or if Tijan, like you know, in your specific circumstance, so we can follow up about that. Okay.
Okay. Thank you very much.
All right. Thank you very much.
Thank you.
Thank you.
Take care.